Now I'm gonna take us back to the earlier age group where we talked about 4-year-olds through second and third grade. My background, as you know, is that of a sensory specialist. I have spent many of my years working with experts like you, and we've collaborated. And tell me if you agree with me and what your thoughts are. But a lot of times we'll get patients coming in saying that my child isn't really following directions, and they seem very defiant. And my question typically is, all right, what does it look like when they don't follow directions? Because one of the things that we look at as sensory specialists are motor planning issues, right? And motor planning isn't just how you maneuver and navigate yourself through an obstacle course. And motor planning can be actual execution of thought. So sometimes processing language in such a way so that they can think, so ideation, they can think of what it is that they need to do, then they actually execute. My teacher told me to paint. I had a child recently who was connected to PediaSource from the school, and the teacher said, this child, they would say, okay, it's time to paint, everyone get your smocks, and everyone's got a station, paint. And this 4 or 5-year-old would stand there by the smocks and not know what to do. But the child's also quite articulate, so they didn't understand where that fell into the world of therapy, if at all. And one of the things I started to parse out was, is there a motor planning issue? And there was. And so as an occupational therapist who's trained in the world of sensory therapy, we would work to deal with the executive functioning aspects of it, even though they were rather young. There is that piece. And also motor planning. How would you address that? And have you also worked in collaboration with sensory specialists?
Yes. So right now I'm working with a little boy who, when I started with him was 4, now he's 5. We have a really great team, which is so fabulous. I highly encourage that for families. So there's a developmental therapist, an occupational therapist, and myself, in addition, obviously, to school. And one of the things that we've started to do is use a visual to help him make a plan, right? Let's make a plan for building the blocks today. Let's make a plan for what you want to do at the writing table. And that plan can be as simple as, I want to play with this boy or this girl, I want to build a house, and when I'm finished, I'm going to move on to something else.
Got it.
Right? Rather than starting and then being lost.
And I think also what we tend to do, especially when we work in groups, is, we parse out which specialist is addressing which aspect of it, and we really hone in on that. And as a sensory therapist, what my goals always were over the past many years were to make sure that the skills learned, whether in the clinic or whether in the school, can be extrapolated into real life situations. So it's not just, if this, then that in this situation, is to train the central nervous system and the brain to understand whenever there is a scenario that triggers this, my brain is going to know how to do that. And so that's the kind of stuff that you will be getting from a sensory specialist. And I think what Stacey and I are saying here is that parents, do not be afraid of and do not shy away from having more than one specialist on your team. I think it is an old, non-progressive thought, and you have to forgive me for saying this, but when we think we only need one specialist and that person's going to take care of all these issues, it's okay to get several specialists. In fact, sometimes the earlier you get many specialists on board to address an issue, the quicker the concern is diffused and it dissipates. I think as we wrap up this wonderful chat session that we've had with such a fantastic, acclaimed, well sought out speech language pathologist here in Chicago, one of the things I want to stress is that Stacey not just works with 4-year-olds through, now we've just talked about the 3rd grade, and we were touching upon what Stacey does with middle school children, but Stacey works with this kind of issues up through high school.
College.
Oh, college. So can you, as we round this out, can you tell parents how you might work with a high school or a college student? Maybe an example of each.
Sure. So one college student a few years ago actually came to me, having worked with a tutor for a number of years, because she was starting to interview for jobs. And she discovered that in her interviewing process, she felt like she wasn't really being as successful as she could be. So we went back to some of what she had learned when she was younger. She could share that with me. She was pretty knowledgeable of about her own awareness of herself and her skills. And we really practiced some of those more nuanced, pragmatic pieces, some of those more nuanced sentence structure pieces and vocabulary pieces, so that she could be more successful in the interview process. With the high schoolers, it might be, how do we parse out this novel that is so dense? And how do we really break it down again to those 5 areas of language? How do I identify vocabulary and make sense of it? How do I take these sentences that are 5 lines long and make sense of them?
So you give them tricks of the trade and how to actually do this so that they can do better maybe with college applications. That particular young adult that you were talking about that had concerns with interviewing, is this a young adult that had a diagnosis?
Oh yeah. She was diagnosed with dyslexia. And I don't remember what else she said, but to me, dyslexia doesn't just mean a reading, a decoding issue. It's a language issue. So she did struggle with aspects of vocabulary. She did struggle with aspects of sentence structure, oral and in written form.
And I guess what we're saying here is there are needs for a language specialist, at least in Stacey's line of work, from 4 years of age all the way through college. And I think that as parents, we want to do as much as we can for our children. And knowing that specialists are here to guide us is incredibly important. Stacey, I cannot thank you enough for being here and giving our parents insight into the world that you live in and that you make better for parents and children.
Oh, it's been a pleasure. Thank you so much.
Well, that's a wrap for Speech Language Pathology this morning.